The following segment is paid for by Holston Medical Group. Well, we know that aging can take a toll on your memory. Becoming a little forgetful is normal, but actual memory loss is different. In tonight's HMG Health Matters, we talk about the difference and we share some tips on how to improve your cognitive function.
Good. And again. A lot of patients that I see, they'll actually come see me and say, I think I'm losing my memory, but it's just old age. And that's not necessarily the case.
Dr. Rana New is a geriatrician with Holston Medical Group. She says some cognitive decline is normal as patients age, but actual memory loss that affects daily life is different.
Like if you're forgetting, did I eat my last meal? When was my last meal? Or forgetting what you have eaten, or especially most severe cases would be forgetting how to bathe and dress and do your day-to-day function. Sometimes though, in the early stages of a problem with memory loss, you'll see things as simple as having problems following instructions.
Dr. New says they may have trouble remembering conversations or begin repeating stories and questions. If this is happening more often, it may be time to have an evaluation and testing.
A lot of things can affect memory. I mean, dementia is one of many things that can affect memory. And if someone has dementia, there's different types of dementia. So how we treat it depends on what the actual problem is.
Keeping your mind and body active is also important. Staying social is key. Dr. New says continued learning can also make a difference.
Things that you do where you're exposed to new information is very important, even if you don't retain it as long as you used to.
Dr. New also says having a good relationship with your primary care provider is crucial, as intervention is important to slow down the process.
I think there is a fear over what you're going to find out. Although we don't necessarily have a cure for every problem that affects memory loss, we definitely have treatments that can slow down that process, which can be extremely important because my patients want to stay active, physically and mentally.
If you think you or a loved one might be experiencing some memory loss, you should reach out to your primary care provider. And for more information on this topic, including other tips, please visit the Health Matters blog at holstonmedicalgroup.com.